Okay, so Dr. Wright, you should have a little box that says.
I just clicked show my screen, so I think that looks pretty good. Now, I am going to switch over to the PowerPoint. Are you able to see the PowerPoint? Just my folks there?
Yep, I can see it.
Very good. Do I need to minimize the chat box area or not?
If you want to, you can, or you can keep it open.
I think I would like to minimize that for right this second. I'm going to just slide it over. There we go. Well, welcome everyone. First off, let me introduce myself to you today. It's a pleasure to be with you. I am a parent of 3 children. I'm married. I have a wife, Debbie. Our oldest child has a disability, a developmental disability. She has the cerebral palsy. She's microcephalic, pituitary dwarfism, and some other complex disabilities as well. She's also speech absent, but she is in a fully inclusive setting for her. She's 11 years old. My middle child, and let me clarify, Ella, my oldest child, we adopted her from the Ukraine when she was 17 months old. My middle child, Elsie, is my child with Angelman Syndrome. We did not think we were able to have children, but we conceived Elsie, and she was born to us about 2 years after we adopted Ella. We were familiar with disability through our involvement with our other daughter, and at 13 months we received a genetic diagnosis of deletion 2 positive. And about 3 years later, we adopted a little boy named Ethan, who's now 5 years old. So I have an 11, 8, and a 5-year-old child. And so just a little bit about me personally. I'm a school guidance counselor. I've worked for the school district in Jefferson County, which is the 16th largest school district in the United States. I consult in the area of government benefits. I'm a past chairperson for the last 3 years of our Medicaid Technical Advisory Council for individuals with developmental and intellectual disabilities. And I am also a consultant for the Special Parent Involvement Network, and I do some resource work for the Angelman Syndrome Foundation. So it's my pleasure to be with you today, and today we're going to talk about government benefits, particularly programs that would be available to Angelman Syndrome individuals and their families, which fully would support community inclusion and improve their quality of life. So with that being said, I'm going to slide forward, and hopefully this will work. Going slow here. All right, for some reason, my PowerPoint is not moving forward. Can you see the PowerPoint moving forward?
No, it's still on the first screen.
All right. Pardon technology, folks. Bear with us. Let's get back here and see if what we're running here. Now we're good. Now we're good. So our objectives of the webinar today are as follows. I want you viewers to have a better understanding of government benefits specific to individuals and families impacted by Angelman Syndrome, really to be better equipped to advocate for access to these benefits and therefore improve the overall quality of life to the beneficiaries, and really have knowledge of key advocacy groups within their own individual states, which can really help them navigate what I believe is a complex system at times to find and gain access to these important governmental programs. So, well, first off, I want to talk about Angelman Syndrome and disability. And according to the federal government, a developmental disability is a severe chronic disability, which really is attributable to mental or physical impairment or a combination of both. It must manifest before the age of 22. It's likely to continue indefinitely and results in a substantial functional limitation in what I think is critically important, 3 or more of the following areas of major life activity. The 3 areas defined by the federal government are self-care, learning, self-direction, economic self-sufficiency, receptive and expressive language, mobility, and the capacity for independent living. So those are critically important. Now, one of the things that I have always had difficulty understanding is how that relates to financial assistance for individuals with developmental disabilities. Well, there are two main financial arms of the federal government that aids with individuals with intellectual and developmental disabilities: Social Security disability insurance and supplemental security income. And today I want to differentiate those things, so I'm going to talk about what are the differences between those two entities. So let's first clarify that both SSI, which stands for, as you saw, Social Security, Supplemental Security Income, and SSDI are government-based programs designed to benefit the disabled. It's critically important that both are, you understand, both are managed by the Social Security Administration as a whole. However, there really are very specific eligibility requirements, and they are very different from each other. And that's a key component because when I was starting out the whole navigation, I was not familiar with how this process worked. And it was important for me to be able to navigate and understand how I could help people find out whether they qualify for either or of these two programs. So one significant difference is that SSDI is only available to workers earning enough work credits with Social Security. So to put it from a parental perspective is that parents who working can qualify their child, an adult child at 22 years of age, to earn SSDI if the parents themselves are disabled or if one of the parents were to pass away. Then their SSDI benefits would then in turn pass on to their children or adult child with Angelman Syndrome. So while SSI disability is very different, the benefits are available to low-income individuals regardless of whether they have earned sufficient work credits or not. So it's just based upon the eligibility criteria of having the intellectual or developmental disability. Now, SSDI, or Social Security Disability Insurance, provides income replacement for eligible individuals who really are unable to work due to a long-term injury or illness that is expected to last for at least 1 year or result in death. I know it's kind of morbid to think of that, but the differences between these two are important to understand. And if a parent, in turn, had worked a substantial portion of their life, they have an adult child with Angelman 22 years or older, this benefit could in turn be a significant financial assistance to that family. Or if one of the parents were in fact to pass away and had earned enough work credits, they could then in turn apply the SSDI benefits to the family of a child who had Angelman Syndrome, an adult child who had Angelman Syndrome. The eligibility requirements for SSDI currently include the following 5 steps. And this is important to understand because it takes a little bit of time with SSDI. First, it's the verification of applicant's disability. You have to verify that the individual actually does in turn have a disability. That could be the person applying for the disability or the child, adult child with a disability, if in fact the parent has passed away. And so you have to have those verification reports, and a death certificate is necessary for a parent who has earned enough work credits, and another parent may be applying for SSDI for an adult child with Angelman. They would have to have the death certificate and the actual disability of the child themselves. They have to file that claim, and there is going to be what's called a recent work and a duration of work test that will be applied to verify the amount of work credits that are eligible for the applying individual. And verification that the individual has not reached a normal retirement age. That's important because that's one of the criteria that is impacted. If they've reached a normal retirement age, then it's a differential in what the benefit is. There is a 5-month waiting period from the onset of the disability. So what they'll do is they're going to put you to a 5-month wait when you make the typical file the application. And it's probably a good reason. The purpose of the 5-month waiting period for SSDI benefits is really twofold. And the government really wants to do 2 things. First, Congress wanted to establish a time frame that would be long enough for a short-term injury or illness to be corrected. Now, with the child with Angelman syndrome, obviously, we understand that that's probably chronic, potentially lifelong, so that disability would then be the benefit if a parent had met the criteria. Regardless, SSDI is meant for long-term illnesses only. And the second purpose is to deter people who can actually work from applying for benefits. It is strongly encouraged that you apply for benefits as soon as possible after one of the onset of the disabling conditions. So I think it's really important to understand. Now, a lot of questions I get about SSDI relate to, well, how much are SSDI benefit payments? Well, they do range, and I'm going to give a little bit of I'm going to give a lot of conversation here about the range of payments and just talk about it so that you have a full understanding. Typically, most SSDI recipients receive somewhere between $300 and $2,200 in benefit. That's most recipients. The average, though, SSDI payment in 2014 is or was currently, I would say, about $1,148, and the maximum disability benefit is currently $2,642. So there is a wide range, and it's based typically on the work credit, the number of years paid into Social Security, which is one of the factors that definitely is used to help determine the benefit. After you receive disability benefits for 24 months, you will automatically become eligible regardless for Medicare, regardless of your age. So you do get an additional pickup of health insurance coverage. And Medicare is very different than Medicaid, and I'm going to spend a lot of time on Medicaid later in this presentation, but with this benefit, you do become eligible after 44 months for Medicare. Unlike SSDI, SSI is strictly a needs-based program, and so I'm going to spend now a little bit of time talking about SSI. To be eligible for SSI, you must have have less than $2,000 in assets if you're single, and less than $3,000 if you're married. Now, children in SSI can receive SSI benefits, and the way that typically occurs is about age 7 is when you will start seeing that, and sometimes sooner based upon gross birth weight as well. There can be some SSI benefits as well. It is a state-by-state criteria to determine whether you're eligible for SSI, but what we have, I'm going to always advocate to parents of children with Angelman syndrome and any disability for that matter, is that they be very conscientious of the amount of money that the individual holds in their actual assets such as checking accounts, particularly. Sometimes it can be a little bit even more complex when there is other benefits that may be listed in their name. It's always best to consult with an accountant and an attorney, I think, when you're trying to get these benefits in place. In 2014, minimum SSI benefits are 2014 were $721 per month for an individual and $1,082 per month for couples. Now, a child is likely, if it's a child that's earning the benefit, probably one child will earn the $721 per month. In a later time, there could be a criteria that would allow them to earn a little bit larger benefit. But again, SSI is a little bit more state by state. There is some differentials in how you qualify in the income payouts state by state. So each state has its own requirements and guidelines regarding the SSI eligibility. It's really important that you understand the state-by-state guidelines and how they impact. But for the purpose of the federal Social Security purposes, there are 4 criteria that must be met to be eligible for SSI. First, you must be blind. So an individual is blind, they qualify, disabled, or age 65 or older. So if any one of those 3, you would qualify for SSI. you must be either a citizen of the United States or meet other very narrow requirements. In some U.S. territories, there are some requirements where they may not actually be considered a citizen of the United States, but they hold some type of visa status that would allow them to qualify for those benefits. Your monthly income must be below a certain level. Now, I didn't give you what that certain level, because what I want you to understand is that each state is very different. And so it's important that you work through your own individual state to determine if you actually qualify. Regardless, I always recommend to particularly parents of younger children with Angelman syndrome or any disability, you should always apply for SSI, and if you are qualified, that will enable you to get some financial benefit, plus it's going to help you qualify for Medicaid, which we're going to talk about later. And then also, even if you're denied SSI, that denial letter must be typically retained state by state to help you be able to qualify for a Medicaid waiver program, which we're going to talk about later in the presentation. Your monthly income must remain below a certain level, so that means that if there is income coming in, that income should be placed into trust if it's going to be saved. Typically, though, SSI is to cover very succinct living expenses, and so therefore it typically is spent, and therefore it should not have any implication on how much is income you have. Your property that you own must be less than $2,000 for an individual or $3,000 for a couple. I came across something recently while I was doing some resource work for Angelman Syndrome Foundation, and one of the things that actually complicated the situation was rental property. Rental property can have an impact on SSI because even though there might be a lien or a loan against that property that would make the value not over $2,000, $3,000, rental property is typically considered to be an income-bearing asset, and it can complicate things. And as I did with this family, I recommend they do consult with an attorney to help them with that process. Now, federal, I want to get into this before I move forward. This is kind of where I'm going to conclude on SSI and SSDI, and I want to move into Medicaid, which is very, very important to me because I am actually part of a Medicaid Technical Advisory Council, and I really try to stay up on Medicaid programs. There are federal and state Medicaid programs. The state programs are a combination of the federal assistance, and the state does set a state plan. It's really important to understand that each state determines how they use federal funds to develop a state Medicaid plan. It varies state by state, and it can be very complex. As I've worked with a number of families, particularly families with Angelman syndrome, many states are very challenging to navigate the system. Even Kentucky, for that matter, where I live, I have a lot of extensive knowledge, but I always have to help sometimes get myself regrounded as I do to help people understand the nuances of trying to get benefits. The plan in a state combines federal funds with state funds to operate the Medicaid programs. Enhanced Medicaid was a big component over the last 3 years, really. There's been an enhanced Medicaid benefit. And some states provide up to 90%, or are provided up to 90% federal funds for 10% state funds. It does, again, some states opted out to do enhanced Medicaid. It just varies state by state. Managed care can now, managed care can impact Medicaid. Now many states are doing managed care plans. However, most states, though, have been using, have been separating their intellectual and developmental disabilities portion of the Medicaid and keeping it as a straight Medicaid program. But states must adhere to what it's really important to understand, they must adhere to certain federal guidelines in the operation of Medicaid programs. So what I did here at this page in this slide is I included a link for an individual to find more information on state-by-state information. And I shared this PowerPoint with Angelman Syndrome Foundation, and I suspect that this will be listed up on the webpage in the future. But this is a state-by-state information on Medicaid, which I believe is really important. Now I want to speak to Medicaid specific to people with Angelman Syndrome, individuals with Angelman Syndrome, children with Angelman Syndrome. And then this is where I'm extremely passionate because I take advantage of the 1915 C waiver. It took me a while to get there, but we were able to do this. And so individuals with Angelman Syndrome do qualify for Medicaid waiver programs, whether they're a child or adult. And waiver programs are offered typically through the Home and Community-Based Services waiver, which is what's considered a 1915 C waiver. You can actually have coverage under two waivers. It varies state by state. So you can actually be a participant in a CHIP program, which is the health insurance program, and still receive the 1915 C waivers. However, that varies state by state. Regardless, you do qualify for these programs, but again, I'm going to talk to you about why it can be complex. Now, for more information about home and community-based services, I want you to visit the link that I've included here too, which kind of gives you a little bit of information about the home and community-based services waivers. Now, state by state, you have level of waivers, sometimes extensive waiting lists, and you need to put your advocate's hat on. So I'm a passionate advocate as a parent. I'm a passionate advocate as a professional who works in this field. People know me to be a passionate advocate, and sometimes you've got to not take no to be literal no. Sometimes you've got to just keep doing your own research. So states provide levels of care for families and individuals with Angelman Syndrome with various levels of support. So if you're looking as an adult with an adult individual with Angelman Syndrome, it's potentially you're considering residential service waivers, services for waivers, and these waivers typically have long and extensive waiting lists. It's really important. If anything I say to you today during this session, I want you to understand this one. Regardless of where you are in your state and regardless of where the waiting list is, it's important to get on these lists as soon as possible. I say this because there's typically a new influx of funding at times, and there could be an influx of roll-off of waivers at times too. And the more likely to get service, you're more likely to get services if you've been on the waiting list for a long period of time. So, like for example, for me, we're on the Supports for Community Living waiver, which is a residential services component waiver in the state of Kentucky. Even though we don't need that waiver currently at this time, we want to be on that waiting list because if the opportunity presented itself, we would still get the services that would be available. Plus, we would have the insurance of a residential component if necessary. You can be on another level of a waiver support. For example, you could be on sometimes it may be a level 1. In Kentucky, we have 3 home and community service waivers. First is the simple one. It's home and community. It's called the Home and Community-Based Services waiver. And we have what's called the Michelle P waiver, is where we are. It's the middle tier. And then we are on the waiting list for the Supports for Community Living waiver. And so you can be on a waiver while you're waiting for more comprehensive waiver services. And really, these are often, there's often a hierarchy of levels. Like for example, level 1, level 2, level 3, typically level 3 being the more comprehensive. And it's important that waiver names vary state by state, and you need to do a little bit of your own research to kind of determine what waivers are offered in each individual state. So I'm going to continue to talk about level waivers, waiting lists, and advocacy in this slide because services provided are really what people want to know. So what do you get? First off, you're going to qualify for this waiver if you receive SSI or even if you've been denied SSI, which I'll talk about here in a little bit too. Services provided by most all waivers include respite care, which is allowing the primary caregiver to take some time away from their individual with Angelman Syndrome and have someone who can be providing that service either in the home or in an alternative location. Respite care can be 24/7, and it is, I believe, invaluable. I think it's one of the most important parts of the components of the waiver. Another component is personal care support. So a child with Angelman or an adult child with Angelman, they need a lot of support potentially with, and we work very diligently as parents to try to have our children be as self-supportive as possible, but realistically, there are times they need help with toileting, they need help with food preparation and eating, medication administration, providing showering and hygiene support, and personal care support is that. Anything that provides a direct personal care to the individual is personal care support. And another component is attendant care, which allows for care for a child or an adult that is in need of those services, so that another person in the home may be able to, in fact, work if desired. So the next PowerPoint bullet point talks about services are provided by higher level waivers too. So, for example, moving up to level 2, you may include all of the above things in the first one, which include respite, personal care, and attendant, but then you throw in something else, such as community living supports, which we have here in Kentucky. We actually, at the level 2, get all of the basic, which is respite, personal care, and attendant care, but then we also get this component called community living supports, which allows our daughter, both our daughters for that matter, to go out into the community and learn how to set very specific goals to be in the community with maybe socialization, behavior, working with people in the community, going to the grocery store, and think about it from this standpoint. They're 8 and 11, so we're very lucky in Kentucky to have that component so they can learn those skills early. As they become eligible for employment, they can also, with the level 2 waiver, get job coaches, which can actually help them develop very specific skills to work in the employment sector. They also typically in a level 2, they get case managers, which help them to actually manage the plan of care, and those are, I think, very important people. We actually have support brokers or case managers in Kentucky, and one thing that is included in our waiver is environmental supports, which is home modifications up to $500 annually. So that's a nice benefit to have if you may need to do a ramp, or you need to do a bathroom that needs to have more ability for that individual to take a shower. So these things can be used as well. Now, services for the higher level, the highest level, typically include all the above services. So they include all the above PowerPoint bullet points, and additionally include the residential supports along with funding for up to 24/7 residential care, which could include staff residents and group homes. So thinking of it from a tier perspective, you want to try to get the highest level that you can, or be on that waiting list for when that opens up, because you want to plan for the future. This is planning for the future to have the 24/7 residential component plus all of these services above that as well. And really the focus of the home and community-based service waivers is to provide supports and services within the individual's community and not in an institutionalized setting. So thinking about that, the focus of the federal government is really to have them be in the community as much as possible. And there are typically 2 ways to receive supports and services. These are big buzzwords right now, or there's a big buzz right now, the whole self-directed option, or SDO. That's the second under this 2 ways to receive it. You can do it through a traditional provider, where an agency who will coordinate all the care along with all the supports and services. Those are traditional providers. What self-directed option, or SDO, allows the individual along with the representative. So like in my family, I'm the representative in my family for both our daughters. I coordinate their supports through the utilization of our own budget. And we can hire, train, and we can literally fire individuals from within their community, So we can hire family, friends, and neighbors. So it's really important that you have that option, I think, because at least for me, having 2 daughters, I think about who I want to hire and who do I trust the most to help provide the options for my daughters. And the purpose of self-directed options really is to allow the individual with family support to direct their services, which are going to overall impact their quality of life. Most important thing, though, is regardless of how the plan of care is often developed, it's really through the person-centered planning process. It should be developed through the person-centered planning process. And think about what your children, adult children, need and what they enjoy and what they like, because I really believe planning for the future is really the key for Medicaid waivers, and they really are critical. Now, there's some additional Medicaid information relating to waiver eligibility. And waiver eligibility really does vary state by state, and some states apply different standards. Like some states apply the 300% above federal poverty rate. So, for example, that would be currently for a family of 5, a family that would be earning $83,730 or less. Now, this is in regard to children, because children can, in fact, get these waiver services if states allow, and we've been very fortunate to have that in our state. But there are other criteria as well. One of the most confusing to me at first was this whole concept of medical institutional deeming. How that works, it's another criteria which is often used by state Medicaid plans. So states, they actually consider a child under 18 as if they are in an ICF-MR facility. That ICF is intensive care facility, and the /MR has still not been removed from the federal database. MR stands for mental retardation. So if a child would actually be in that facility if they did not in turn have parents to help them. So they actually let that child stand alone, and their income therefore stands alone as well, and they don't count parents' income or assets. So if you have a state that does allow that type of criteria, it's very likely that you would qualify for a Medicaid waiver. So it's important. You still have to apply for SSI and keep the denial letter, because the denial letter is typically a component to making the application, even if they use medical or institutional deeming. They want to know that you've applied, and they're going to want to know what your income level is. And most likely, both children and adults qualify for waivers based on income or if it's medically institutionally deemed. So the bottom line here is, folks, most of our children all qualify. Most of our children are going to qualify. Most of our adult children qualify for a Medicaid waiver, and it just varies state by state on how you get those waivers. Now, another thing that does come into play a lot of time is guardianship, and guardianship becomes important at an age somewhere between 18 and 21. And I was just giving Amy today, who does the Angelman Syndrome Foundation's webpage, a link that has some information about each state and their procedures to apply for guardianship for an adult with Angelman syndrome. It's really important that you have an understanding of when guardianship becomes important, because benefits change when they become what's considered to be an adult. Now, there are some other Medicaid programs. The most important thing is getting into whatever tier level waiver you can get into and getting on the waiting list for the next tiers that would be available to you if there were, in fact, no waiting list. In most states, it is very possible that you can apply and get into a lower tier level waiver, which is going to give you Medicaid. And once you get Medicaid, there are some other benefits. And this is where I'm going to talk about the other Medicaid programs that are not necessarily waiver programs, but if you get access to Medicaid, you get some state Medicaid plan benefits, which are very important for you to consider. Some of these programs are specific for children, and some programs can help families overall. So let's go back to Medicaid and the mandatory federal benefits. So if you get Medicaid in your state, even at the lowest tier level, these are some of the benefits that you're going to get. You're going to get physician services, hospital services, laboratory x-ray services, EPS-DT, and that's for individuals under 21. We're going to talk more about that in a couple more slides. Medical and surgical dental services, rural and federally qualified health center services, family planning, pediatric and family nurse practitioner service, nurse midwife service. Now, some of these don't apply to us specifically, but these are the mandatory federal benefits. And then one of the things it does is the home health care for persons eligible for nursing facility services. So going back to the acronym ICF-MR, nursing level of care usually coincides with ICF and MR qualification. And so you can get home health care as well And then in home health care, you can get durable medical equipment often. It varies state by state, but that's important. Now, these are some of the optional state-covered services. Optionally, you will get prescription drugs, clinic services, prosthetic services, and these vary state by state. You need to kind of know what would be covered state by state, but I wanted to make sure you knew what I'm going back here, the mandatory federal benefits and the optional. And it's important you really pay close attention to the mandatory federal benefits. Now let's talk about Medicaid and children that are 0 to 21 and EPSDT. Now this is an acronym that it's part of every state plan, Early and Periodic Screening Diagnosis Treatment Program, EPSDT. And it's available if you actually in turn do get Medicaid services and you have a child under the age of 21. So EPSD is from the Health Resources and Administration from the Bureau of Maternal and Child Health. So it's funded through a different arm of Medicaid. So, and here's this is directly from the federal EPSDT website. And this is really important to understand. While there is no federal definition of preventive medical necessity federal amount, and the duration and scope rules require that coverage limits must be sufficient to ensure that the purpose of the benefit can be reasonably achieved. And so since the purpose of EPSDT is to prevent the onset of worsening of a disability and illness of children, the standard of coverage is necessarily broad. Now that's a big statement. What does that mean? Well, it means a lot if you get that coverage because it can cover things that are medically necessary and it can cover it on a very broad scope. And so if you have a doctor, that you have a pediatrician that will help you out, you can get a lot of services here. And the standard of medical necessity is used by a state. Used by a state must be one that ensures a sufficient level of coverage. And so I'm going to use my example here in Kentucky. Like for our daughters, PT, OT, and speech therapy, so those are physical therapy, occupational therapy, and speech therapy. On my primary insurance plan, I have a limitation of 18 visits for each of those areas. And then I have to go back and try to get coverage for additional 12, which is like pulling teeth to Humana. However, with our Medicaid and EPSDT, we can get PT, OT, and speech unlimited weekly, twice weekly if necessary, and that burden comes to Medicaid in our state. So we take advantage of it. We do OT and speech therapy every week, and we have been very blessed that we have not had to use the physical therapy within the last 3 years. So one other important program that I think is really critically important to understand is the HIP programs. So now we know that you can qualify for Medicaid through a waiver program. You know about EPSDT is available for children from 0 to 21. This HIP program is something it's kind of one of those Medicaid mysteries out there, but I've done a lot of research into it, and we do have a HIP program in Kentucky. It's the Health Insurance Premium Payment Program. And it's a Medicaid program that allows a recipient's family to receive free private health insurance paid for entirely by their state's Medicaid program. So let me put it like this. The state of Kentucky really values that I keep primary insurance on my family, and I'm in a group plan in Kentucky, and so my premiums run about $500 a month at the highest level plan. But Medicaid wants me to keep that insurance because they want the burden of my health needs for my children who want, it's about if one child, one individual in your family qualifies for Medicaid, which my children qualify through Medicaid through the waiver program, they want to make sure that I keep that primary coverage on and so they pay my entire premium for my whole family so that my primary insurance has the burden of most of the cost. Matter of fact, if my family were to lose, if I were to lose my job, they would pick up COBRA so that they would make sure that I had full coverage of my insurance so that they would be payer of plasters, or Medicaid, that is. So it has to be considered cost-effective, deemed cost-effective by the HIP program in their state. So they'll look at certain things like they're going to do it from an actuarial standpoint. They're going to look at what the benefit is per child. But in our case, with complex medications being part of, a lot of the time, our children with Angelman or adult children with Angelman, they are going to definitely pick it up because the medications are very expensive, and they want those primary insurance providers to have the burden of the cost. And then you get Medicaid as a secondary insurance provider. And this is part of the Omnibus Budget Reconciliation Act of 1990, which is, authorized states to implement these HIP programs. I didn't know about it until about 2 years after I had Medicaid, and somebody said, "Have you heard about this?" And I said, "Nah, that's not really true." And sure enough, I started sending them a copy of my check stub with my premium on it after I enrolled, and they started sending me reimbursement checks for my family. So in closing, I want to talk about what you have to do and some advocacy resources that are in your state too. And I want to highlight 3 in particular. First, there's a federal act that really is important that you understand, and it's the Developmental Disabilities Assisted and Bill of Rights Act, which is known as the DD Act. It was reauthorized a long time ago, back in 1963. It was last reauthorized in 2000. And what it does is it allows that a pretty good coverage, or I say resources, state by state, that help families navigate sometimes these complex systems, which means full integration, inclusion in economic, political, social, cultural, religious, and educational sectors of our society. It really ensures that individuals with developmental disabilities and their families participate in the design of or have access to culturally competent services, supports, and other assistance and opportunities that promote independence, productivity, integration, and inclusion in the community. So that is what the DD Act has. There are 3 or 4 big components of it. Let's talk about the 4 components. State by state, key agencies that are in your state are part of the DD Act are the state and territorial councils on developmental disabilities. Those councils have a lot of impact on developing policy state by state. I served a 6-year term on the Kentucky Council on Developmental Disabilities, and I was a governor appointee, and I learned more by sitting on that council about how to get services, because the people who serve on these councils are people that know a lot. It's just typically in the state of Kentucky, it's 16 family members or individuals that have intellectual or developmental disabilities. There's also another component, the University Centers for Excellence in Developmental Disabilities Education, Research, and Service, are often called USED. These are centers of excellence that each state has a university who has the obligation of having a University Center of Excellence. And what they do is all of the work that they do is related to disabilities education, research, and service. And so if you want to look within where you can find the most recent research, how to find the best information on education or even service within your state, turn to your University Center of Excellence. I think the most important, though, is the 3rd bullet, protection and advocacy systems. By law, each state under the DD Act has to have a protection and advocacy system in place, which advocates and can, in fact, have legal assistance to families should they believe that they are not having their rights upheld according to this definition right here. So you can contact them and say, I don't believe we have access to culturally competent services or supports. And really, each state has a P&A system that can help with that process. Matter of fact, in the state of Kentucky, it was in fact protection and advocacy in 2007 and 8 that sued our cabinet for health and family services because they did not believe we had a comprehensive waiver system to serve all individuals that had needs. And then each state does have projects of national significance, so I believe it's important. So this is some information about the Council on Developmental Disabilities, and this talks about what they do. It really has people, it helps people with developmental disabilities
and they help people develop training activities, community education, and on how to develop support systems. They help develop policy in the state. That's a big one. Policy is big. So like we've had an autism bill that's passed as a direct result of a IDI Council initiative. And it really helps us eliminate barriers to developmental disability issues. And a key mission of the council is to advise the governor and the state agencies on how to use these resources. So they really build this capacity, and their scope of work is so important that they help people exercise really self-determination and help them to be able to really live within their communities. The USED is a grant program. That's the University Centers of Educational Excellence. And what they do is they provide a lot of technical assistance. They have professors that are full tenure professors that are teaching just on disability policy, disability law, inclusion activities, educational inclusion, integration into the community, all of these things. They have people that teach. And really, it's interdisciplinary. It could be that they have an individual who's a speech therapist working with an individual who is a psychologist. They have an individual who's an educator or a tenured educator on special needs working with a therapist. So it's really a great model that often does not get utilized, I think, to its fullest extent. And lastly, and I'll talk about the national significance as well, each state has its P&A, and really that's the big one. I think P&As are independent, so they don't serve at the request of the governor. They're a service-providing agency that offers information and referral services for legal, administrative, and other remedies to resolve problems for individuals and groups. So think of it like this. If I took out individual, put it like this. They can provide legal, administrative, and other remedies to resolve problems for children or adults with Angelman syndrome. That's what they're required to do. So if you're here listening to this webinar today, one of the things I want you to hear the most is you have a legal agency in your state that's required by the DD Act to help you. And you have that right to contact them and get help. P&As enhance quality of life for people with developmental disabilities. They investigate abuse, neglect. They investigate situations where they're not receiving services and they want people to receive services within institutional settings only. These are the people that can help you. And the program of national significance, and just put it this way, it's each state is encouraged to try to develop an innovative program or project to create better opportunities and to make educational decisions and help influence policymakers. There are many different programs of national significance that are out there, one of which I've gotten involved with was one involving recreational. In Kentucky, we developed a program in Kentucky where we actually do a recreational involvement fund, and families can apply for up to $750 to help include their children in recreational opportunities if these children have developmental, adult children, too, developmental and intellectual disabilities. Lastly, and I've got a couple more slides here, I'm just going to pop through. Yeah, I think this is my last slide. What I want you to know, too, is that there's an organization that I've been involved with for a long time. It's the national and state ARC chapters. And the ARC of the United States is really an organization serving people with intellectual and developmental disabilities. It's been around since the 1950s. And really, I want you to know this, that since that time, the organization has grown and has established 39 chapters in 39 states with 730 local chapters across the country. And what their whole focus is to be they're an agency to help people advocate for themselves or individuals to advocate for themselves, to get supports and services that really they are entitled to by law. And regardless of whether these benefits are government or federal government or state benefits, if they're entitled to it, they will help you find ways to get those services. So in closing today, I just want to thank you for your time. I want you to know that I'm passionate about this. I'm more than willing to answer any of your questions, and I hope I can. If you do have questions for me, just continue to put them up on the webpage. And again, thank you for your time today.
Thanks, Dr. Wright. We do have a couple questions that came over, so I'll go ahead and ask those now.
All right, I'm trying to get back to where I can see them as well.
I don't know if you can see the questions. I think only I might be able to.
Was everybody able to hear me, though?
Yeah.
Okay, great.
Yep. And a lot of people have asked if they can have the PowerPoint presentation, so if that's okay with you, if we can post that to our website either today or tomorrow, so people can get those. All right, so we'll post those later. One of the questions is regarding SSI asset and income restrictions. Is this for the child with AS or the parent?
The SSI is really going to be individually specific to, well, it's a state-by-state criteria. So that question is probably going to be best answered by someone within their state that would have knowledge of that. For us, it actually did use our income of the parent. So if it's a child under the age of 21, they use the parental income as the criteria. But once they are adult, then they at adult age, they can actually they qualify for SSI. Do you understand what I'm saying there? Does that make sense?
It makes sense to me. I don't.
All right, good.
So the person who asked that question, if you have any follow-ups, go ahead and type it into the question box, and I'll follow up. Another question is, can you explain again what premiums you get reimbursed for and why?
Yeah, so we get reimbursed our primary insurance premium for our daughters who qualify for Medicaid, and actually for our entire family because of the HIP program, which is the Health Insurance Premium Payment Program. They get reimbursed because they want us to carry primary insurance so that they reduce the burden on the Medicaid insurance. It's really an actuarial standpoint, so they want to reduce their costs by having you have primary insurance, and so they pay your premiums for you.
Okay. And I don't know if you'll know the answer to this one, but I'm going to ask it. Hold on, just moved. It says our daughter is on medical. Is medical the name for Medicaid in the state of California?
I have done a little work on it's called MedCal is what I think in California. So and actually really I can do a little, tell them I'll do a little bit more research on it. If they want to contact me through the ASF site individually, I will research it and get back with them.
Okay.
Yeah.
Yeah, he has another follow-up. I'm sorry, go ahead.
Tell them they can do it through the ASF resource link and request ASF Family Resource Assistance. Okay.
He has some more state-specific questions, so
sure.
Mr. Williams, if you want to just follow up with us, and we can send them over to Dr. Wright to take a look at for you. Here's another one. It's for adults, the SSI is not based on parents' income in my state and most others too, only the adult child's assets.
That's correct. That is right.
Okay.
SSI. For SSI, yes.
Yep, SSI.
For adult.
And we have one more question. Is it HIPP? Is that a state-by-state thing?
It is. It is state by state, and it's important. So my advice to anyone is to Google search their state name and HIPP, and to see if they get any results in their state.
Okay.
The other thing is they can call. They just put their state name in Medicaid and call their Medicaid department directly to ask if they have a HIP program. But they, sometimes it's going to be easy. It's harder to navigate that system because really people don't know sometimes. And I'll be glad to help them out. If they, again, wanted to reach me, I will investigate their state for them.
Okay. This question is, who do you process for the HIP reimbursement through?
It's actually, in Kentucky, it's a third-party agency, and how they do it is you enroll. There's a third-party agency who's contracting with Medicaid. Once you enroll, we've done it both ways. At one time, I would just submit a PDF copy of my pay stub with my premium out of it, my primary insurance premium, and then they in turn would do a direct deposit into my bank account. Recently, though, I have to give them a copy of my PDF pay stub, and then they in turn send me a check. Literally.
Okay, we have just a couple more. Sorry, they keep rolling in, so I'll try to get through them. Does SSDI go on parents' income?
SSDI is based on work credits and Social Security payments. So really, SSDI is going to be related mostly to, it's related mostly to, well, it is related to parental income, and it's related to how much work credits you've earned. It's not income-based for a family. It's based on work credits.
Okay. And then the last question, and then we'll wrap up. For adults, we have heard the amount changes when the parent retires. Is that true?
That is true. And I didn't put any detailed information about that. I will let them know that I'll do a little research on that. And if you could follow up maybe and remind me about that. What I need to do is it does change, and it is impacted by retirement age. And I want to think that it's mostly related to SSI. It's not as much as, well, no, I think it does with both. But the answer to the question is that yes, it is impacted by retirement age. Best to check state by state is how I would answer that.
Okay. All right, well, we're going to go ahead and wrap it up so we can keep this to an hour. We did have a couple other questions roll in, and I'll just send those to you afterwards, and then we can send them to everybody so they can see the answers to that. Thank you, Dr. Wright, so much for taking time out of your day to do this presentation. We did record this session for anybody who had to, jump off or wants to review it again, or, send it to anybody else that would like to watch it. It should be up on our website. We'll send you a link to our YouTube channel next week. So thank you again for attending, and have a good Labor Day weekend.
Thank you so much, and thank you, Sheila, for your help.
Yeah, no problem.
All righty, bye-bye.
Bye.